Hello everyone and welcome to Prostate Patrol, a channel dedicated to men's health. Today, we're going to delve into the fascinating world of testosterone replacement therapy, TRT, and everything you need to know about it. Testosterone replacement therapy, TRT, is a medical treatment used to increase testosterone levels in men who have a deficiency of this hormone. Definition and purpose. TRT is a medical treatment designed to correct low levels of testosterone in men, a condition known as hypogonadism. This disorder can have various causes, ranging from genetic issues to testicular injuries or the side effects of certain medical treatments, such as chemotherapy. The main goal of TRT is to restore testosterone levels to a healthy range, which can alleviate symptoms associated with testosterone deficiency. Administration methods. TRT can be administered in various forms, each with its advantages and considerations. Common methods include topical gels applied to the skin, patches adhered to the body, intramuscular injections, subcutaneous implants inserted under the skin, buccal tablets dissolved in the mouth, as well as creams and nasal sprays. The choice of administration method depends on various factors, such as patient preference, convenience, and response to treatment. Objectives and benefits. The main objectives of TRT are to restore testosterone levels to a healthy range and alleviate symptoms associated with testosterone deficiency. Some potential benefits of TRT include increased libido, improved erectile function, increased energy and vitality, increased muscle mass and strength, improved mood and sleep quality, as well as a reduction in body fat and the risk of osteoporosis. Medical evaluation. Before starting TRT, patients need to undergo a thorough evaluation by a specialist in endocrinology or urology. This may involve laboratory tests to measure testosterone levels in the blood, as well as an assessment of symptoms and the patient's medical history. It is important to identify the underlying cause of testosterone deficiency to determine the best treatment approach and ensure its safety and efficacy. Risks and side effects. Although TRT can be beneficial for many men, it also carries potential risks and side effects. Some common side effects include acne, fluid retention, increased risk of blood clots, prostate enlargement, reduced sperm count, and increased risk of prostate cancer, although the latter is controversial and not well established. It is important to discuss these risks and side effects with a doctor before starting TRT. Regular monitoring. During TRT treatment, patients need to be regularly monitored by a doctor to assess the effectiveness of the treatment. Monitor testosterone levels and detect any potential side effects or complications. This may involve periodic laboratory tests and clinical evaluations to ensure that the treatment is safe and effective in the long term. Special considerations. Some men may not be suitable candidates for TRT, such as those with a history of prostate cancer or those who wish to conceive children in the future. Additionally, it is important to discuss any concerns or questions with a doctor before starting TRT. The doctor can also provide guidance on managing other risk factors, such as controlling blood pressure and cholesterol. Lifestyle and TRT. In addition to medical treatment, adopting a healthy lifestyle can complement TRT and improve its results. This includes following a balanced diet, exercising regularly, managing stress, maintaining a healthy weight, and avoiding excessive alcohol and tobacco consumption. Education and empowerment. Patients need to understand the objectives, benefits, risks, and considerations of TRT to make informed decisions about their health. Education and empowerment are key to effective management of testosterone deficiency. Patients should feel comfortable asking questions and actively participating in their treatment plan in collaboration with their doctor. Testosterone replacement therapy can be an effective tool for improving the quality of life for men with testosterone deficiency. But it is important to undergo it under the careful supervision and monitoring of a specialized doctor. Don't forget to subscribe to our channel and like this video. Your support helps us continue creating content that can make a difference in men's lives. See you in the next video.